We have a lot of good content today to cover, so thank you everyone for joining us. My name is Ellen Albright. I am the Director of Talent and Workforce Development with the Greater Reading Chamber Alliance, and we are super jazzed to be putting on a three-part series in partnership with Berks County Intermediate Unit. Our hope through this series is to just better educate and create awareness about the state of education and the many factors going into decision-making, both in reentry plans and also in taking into account the business side of things. So pairing the conversation between educators and administrators with the concerns and feedback from the business community. And so in coming at it from the BCIU and the GRCA, we can kind of cover the best of both of those worlds and try to come together with our community to come up with solutions and have conversations about the many different topics and issues as we look at this in a COVID-19 world. So today we are joined by Katie Hetherington-Comfer. She is the Director of Government and Community Relations with GRCA. She's going to co-present and help me facilitate some of the questions today. And we are joined by Christy Weitzel and Karen Grimm-Thomas. So I am going to go through their very jam-packed bios for you today. And so bear with me, I'm going to read them from a paper because I wouldn't want to miss anything, and they have quite a few credentials and accomplishments that I want to share with you as we move into speaking with them and getting their expertise on the topics today of the impacts on childcare in education. So without further ado, I'm going to read off this paper, so bear with me. First up is Christy Weitzel. She serves as the Assistant Director of the Office of Early Childhood and Student Services. Christy started her career in preschool education in 1996 as a director, preschool teacher at Country Meadows Childcare. In 2006, she began working at the BCIU in the Office of Early Childhood and Student Services as a specialized itinerant in early intervention. In 2012, Christy was appointed the Assistant Program Administrator, these are a mouthful of titles here, of Early Intervention, moving to the Program Administrator of Early Intervention in 2014. She served in this role until her appointment to Assistant Director in November 2017. Christy earned her dual bachelor's degree in elementary education and early childhood from Kutztown University and her master's degree from Wilkes University. She also completed her supervisory certification from Eastern University. Karen Grimm-Thomas. Karen is the Director of External Relations for the Pennsylvania Office of Child Development and Early Learning, OCDEL, because we like our acronyms so much. She earned her BS in Human Development and Family Studies from Penn State, followed by a master's degree from the University of Illinois at Urbana-Champaign. Karen spent the majority of her career working in the federally funded Head Start Early Head Start program, where she held a number of roles, including classroom mentor, education coordinator, and training coordinator. Prior to coming to OCDEL, she spent 12 years as the Associate Director of the Pennsylvania Head Start Association, a statewide advocacy organization that provides training, technical assistance, and advocacy on behalf of Pennsylvania's Head Start, Early Head Start programs, staff, and families. In her current role, Karen works to coordinate OCDEL's stakeholder engagement in order to promote a deeper understanding of OCDEL policy in the field and provide feedback on how policy is being experienced in the day-to-day work of OCDEL's stakeholders. So welcome, Christy and Karen. Thank you so much today for being here and for walking us through what will be a very important, very fluid topic over the next few weeks, few months, and probably a couple of years. So we appreciate your guidance and expertise in leading us through these topics today. We're going to lead in with a question to kind of just better get to know you, the programs you serve, and sort of what your focus has been as we've looked to pivot during COVID-19. And so I'm going to pose this question to both of you. Feel free to fight for who goes first. But here's the question. As you have been navigating between guidance and regulations all spring and summer and looking to the fall, what areas specifically have you been able to narrow down your focus to within your organization and specifically your role? Please also take this time to further introduce yourself and your roles within your organization. So again, a little bit about you, a little bit about where you're at, and then also how you've been able to narrow your scope in your individual areas of expertise and what you've been working on. Christy, you're already off mute, so I say you go first.
Okay. Elected by deferment, perfect. So again, Christy Weitzel, and I do work for the Berks County Intermediate Unit. I am the Assistant Director for Early Childhood Services. So we provide oversee 4 programs. Early intervention, which is special education for preschool students ages 3 to 5. Head Start, which is a federally funded program for students that are socioeconomic disadvantaged. Their family's income level needs to be at 100% poverty or below. Pre-K Counts, which is a state-funded program for, again, preschool age students, and their income level needs to be at 300% poverty or below. And then lastly, childcare, which is the one we're going to speak specifically about today. But we do provide services to approximately 3,500 students across those 4 early childhood programs. But focusing really on childcare, just to answer your question, I kind of need to start with the slide that kind of gives you an overview of childcare and where we're at and what we provided pre-COVID, that March date. So we have pre and continued COVID, I guess. But so we provide childcare services. All of our programs are Star 3 and 4, which according to the Octal's Keystone Stars and Quality Improvement System, indicates that we offer high quality programming. In childcare alone, we provide services to 350 students. We had 12 classrooms, which were a combination of preschool, as well as before and after care programs, school age programs for students. We did and continue to provide hours of care Monday through Friday, that's 6 to 6:30, depending on the location, till 6 o'clock in the evening. And we did provide childcare within school district boundaries and actually within school districts themselves. We are in the Exeter, Daniel Boone, Schuylkill Valley, and then we are also with BCIU sites at Hamburg, Reading, Muhlenberg, and Antietam school districts. So if you want to just advance to the next slide and address your question, kind of a little bit at the next slide that talks about how we reduced a little bit. So we have, as of the COVID situation, we have dropped ourselves. We have to reduce our numbers of students in the classroom based upon the need of social distance. That was in the yellow phase under Department of Human Services. We were able to open childcare in the yellow phase. So as of June 15th, we opened. We reduced the number of students in the classrooms. We also needed to establish some cohorts of students and staff, so there's no intermingling. And so we went from those 12 classrooms down to 6. We were in the different sites, and now we've dropped down to just 3 sites, which is the BCIU, our main sites, which allows us to control the cleaning and the custodial crew and entering and exiting the building, as well as we weren't able to be in some of the district locations, so we had to make some changes. So we have made obviously some reductions in locations, reductions in students. We had to make some changes to procedures and readjust and rethink the ways we do business. We do have a little bit of a benefit probably because we are a large organization, so we can make those changes, which we'll speak a little bit about later, maybe a little bit quicker than maybe some other smaller programs, but we also have some more staff support to help with that. So we really had to make some adjustments, as did everybody across the state. We worked collaboratively with some of our local preschools and child care centers, so we can kind of mimic some of the same things that we were doing the same as they were. So I think that kind of answers a little bit of that question. I can let Karen then speak about that as well.
Okay, can you guys hear me? Everything okay? Okay, great. Okay, so thank you for having me on this webinar. Again, my name's Karen Grimm-Thomas. I'm the Director of External Relations for the Office of Child Development and Early Learning. We do like our acronyms. We also like our shortened things, so we often are referred to as OCDEL. OCDEL is a very unique office within state government because it's what we would call a dual deputate. So my immediate supervisor is the Deputy Secretary of OCDEL. Her name's Tracy Campanini. And basically our office sits underneath both the Department of Human Services with the Secretary of Human Services, Teresa Miller, and we sit underneath the Department of Education. So the Secretary of Education, Pedro Rivera. So my immediate supervisor, Tracy, the Deputy Secretary, reports to both those secretaries. So typically in state offices, you report to one secretary. You're located in a department. It's a really interesting arrangement. Pennsylvania was pretty much the first state to do that. And basically what that allowed us to do was to take the majority of the programming that's offered for children ages birth to, we theoretically say birth to 5, but it really does go up into the early school age era because of our childcare regulations and children that are able to be in school age care. But it took all of that programming for that age group of children and located it within one office, as opposed to other states where things might be in different offices. And this way, the left hand kind of has an idea of what the right hand is doing, theoretically. So our office, our biggest, what we really do is we license and monitor all of the certified childcare programs in Pennsylvania. We administer the Childcare Works program, which is what we call the subsidized childcare program that's funded through federal dollars through the Child Care Development Block Grant in Pennsylvania. So we refer to that as Childcare Works. We do that with our business partners, the Early Learning Resource Centers across the state. We also administer and monitor both the birth to 3 and the 3 to 5 early intervention systems. And then we also, oversee, administer, and monitor home visiting and family support services in Pennsylvania. So any of our evidence-based home visiting programs that are either funded federally through the HRSA or through state dollars. And then we also administer and monitor our state pre-K programs, which are pre-K counts, that Christy referred to, and then the Head Start program. So it's a little interesting with the Head Start program because we're not actually monitoring them. Pennsylvania was, again, one of the first states to take state dollars and say to federal Head Start grantees, we'll use our state dollars, you take the model that you're doing for your federal grants and just add additional children on. And it was just a way for us to increase the number of high quality pre-K seats that were happening in the Commonwealth, and to target kids that were age and income eligible for Head Start that really benefit from those comprehensive services. So in terms of the COVID crisis, our office was incredibly busy because all of our programs were impacted by that. This call is really focusing on childcare, so I'm going to try to focus on that. It's interesting for us though, because the way our system is set up, we are, again, another way that we're unique from other states, because we have what we would refer to as a mixed delivery system for a lot of our programming. And that basically means that when we look at our state funded pre-K programs, we didn't just say that only school districts could be recipients and providers of that. We felt very strongly in the entire early childhood system. So the childcare portion of it, our private nursery schools, our Head Start programs, and then school districts that were offering pre-K, because at the time, there was something called the Accountability Block Grant, and that allowed school districts to take dollars and do pre-K programming. So we really believed that this mixed delivery system was important. So although this call is focused on childcare, it's often hard for our office to separate those things out because that we have all of these different types of programs that are offering these services, and they are through the years have gotten very good at blending funding so that they can really maximize the impacts that they have on their communities. So in terms of childcare, we really had to scramble in our office. Everything, I think the thing to think about throughout this entire call, and I'll keep coming back to this, is the incredibly fast and ever-changing nature of what is happening with this crisis. Because it is a novel virus and we've never had anything like this before, we are typically, we're operating on our best known data and our best known information. And as we learn new things, the Wolf administration has been really, really focused on making sure that we're using the most up-to-date information, the most up-to-date science. And in the minute something becomes, out of date, or we think we have learned that there's a better way of doing something, they've not hesitated to switch gears and move to that. So as an office, it's been challenging to stay up to date. It's been challenging to keep the field really up to date because things have just changed a lot. Even from the beginning of the crisis when school districts were initially closed, how did that impact our childcare programs? Because there were so many of them that were located in school districts. And then when stay-at-home orders came, although childcare wasn't looked at as an essential business, we were able to have childcares operate if they applied for a waiver to provide services to the children of essential services staff, because those folks still needed to go to work. We had a lot of work to kind of help the community and providers understand why was it not safe for schools to be open, but it was okay for childcare to be open. And from the very beginning, really had to point programs towards the Center for Disease Control and the guidance that they were putting out on how to safely run a childcare program. So throughout the crisis, we had about 1,500 programs that had applied for waivers and were providing childcare to the children of essential services staff. And so we were also trying to provide supports to them. I think I'm gonna pause. Ellen, have I answered your question thoroughly? That's good at this point? Okay.
I think, just being able to introduce what the both of you are truly doing within your roles, within your organizations, and how responsive you've been able to be, that really helps us understand where you've been focusing and how you've been able to narrow the scope of your focus a little bit during this time. So absolutely, we can dig into some questions now. I'm going to take the PowerPoint off the screen for a bit here, but at any time if you want to refer back to your slides, Christy or Karen, please let me know and I can bring them back up. All right, now we can all look at one another again. So, okay. All right, first question. And this again is, our role is to really help our business community understand how to embrace all of this change and be available and flexible to their employees. And so you'll see that woven into a lot of the conversation today. So the first question is, what should the business community be prepared to do to support its employees, many of whom have families and school-aged children affected by the adjustments being made frequently to guidelines and regulations? So Karen or Christy, whoever wants to tackle that first.
So I think I'll probably start with a state level perspective, and then Christy can chime in with that more kind of, this is what it looks like on the ground. I would say one of the biggest things for the business community to understand, again, is the changing nature of this crisis and the impact that it's had to childcare. I think we know that having safe, stable childcare is a huge, huge thing for employees. And I know you as business owners and employers understand that when your staff at your site, at your business are struggling with childcare needs, and they can't, they have to continually go and deal with that, that really takes away from the work that they were able to do. And unfortunately, this crisis, because the childcare community in general was closed and now is trying to open back up, and the nature of their business in terms of needing to operate at full capacity to really be able to stay afloat, it becomes really problematic because there's a number of reasons why they're not able to really operate at full capacity at this point. And it's everything from not all parents are back to work full time, and so they might not need that care. Some families have found alternate arrangements during the stay-at-home orders and maybe are not comfortable yet having their children come back. There are guidelines that programs need to meet that really recommend having smaller numbers and doing different kinds of programming. So the care might not be as readily available. The other issue is that because of the changing nature of the crisis, programs had to institute, and Christy can speak more specifically to this, a lot of new policies, a lot of changes to how they typically did business. And for families who are used to just kind of this regular everyday, early childhood education is about routines. We're totally about routines, and young children are totally about routines. And the fact that they need to institute new policies, and that those policies then needed to change, and then those policies needed to change. And chances are next week, we're gonna call people up and tell them that those policies need to change. So what an employer is telling you one week about what's happening at their childcare site and what they're trying to deal with could change on a dime. So really making sure that you're working with employees to understand how their childcare is adapting and what their childcare is doing. I think that's really important, just to understand that, and to understand that they're not necessarily, if they're telling you things are changing, they're telling you the truth. And one way of, maybe helping with that might be to think about the childcares that your employees are accessing, and reach out to them to really kind of have a conversation about how things are going. Is there anything that as a business I can do to support you? What are your policies at this point in place? So that they know who you are, and maybe even request that if you change policies, is there any way you can let us know what those are? Can I see what they are? Just so you're understanding what your staff are really dealing with. Ellen, can you put, I'm sorry to ask if you could put that slides back up, because I do think it's kind of to help them see what programs are dealing with.
You bet. Give me 1 second here.
So in terms of the most up-to-date information for programs right now, our office, if you could go back one, yeah, that's it. So there are 3 pieces that they really need to pay attention to. The first is huge. It's the Center for Disease Control, the guidance for childcare programs that remain open. This is guidance that the CDC put out very early on in the crisis. There have been some updates to it, but it's really about how to keep young children, how to operate childcare and keep kids and staff safe. It's all the social distancing, it's all the extra precautions. And so this is the basis for a lot of what they're doing. Pennsylvania Department of Health chose very early on to just point programs to that guidance versus coming up with our own, because it was consistently changing. And we felt that the Center for Disease Control had information from other countries. They had information from across the country that was feeding into those recommendations. The second piece is interim guidance for certified childcare facilities operating during the novel coronavirus pandemic here in Pennsylvania. So about 3 or 4 weeks ago, as things did kind of get into a bit of a calmer point, we did decide as an office and through the department, with the Department of Health, to issue some additional guidance for programs. It's aligned with the CDC guidance. It was more about trying to help programs kind of unpack the CDC guidance and really kind of tune into what we considered the really critical, the things that were really important to follow. And then about a week or 2 ago, we put out the third piece of information, which is COVID-19 operations for licensed childcare facility. Throughout the crisis, what we've really struggled with, and with programs have struggled with, is the idea that the CDC guidance is just that, it's guidance. And in Pennsylvania, childcare programs are monitored and held up to a standard of what our childcare regulations, our certified childcare regulations are. So we've had to have lots of conversations about the difference between guidance and regulations. And the fact that if it's not within our childcare regulations, we can't cite a program for not doing something. So although the expectation was that they were following this guidance to keep kids and staff safe, we really had no mechanism to hold them accountable for that. And so Department of Human Services Legal was able to kind of look through some things and look at our regulations. And they did come up with what they were calling 4 critical elements. And if Ellen, you could go to the next slide. So these are 4 elements that are within the CDC guidance and within our guidance to programs that we have said, that DHS Legal has said we can cite programs on. Whoops, there we go. So the big one is face coverings for staff. So we understand that when Secretary Levine put out the order for universal face coverings, that was part of the impetus for this. So we know that there are going to be a small portion of staff who medically are unable to wear a mask, just like Secretary Levine, they recognize that in the order. But absent those staff, the expectation is that the rest of childcare staff are following that order. And so if a certification representative would enter a program and they were not wearing masks and they did not have a medical reason for not wearing the mask, they could be cited. We also felt that it was really critical that they have some kind of a screening procedure for anyone entering the facility. So on a daily basis, they are doing temperature checks. They are asking questions about COVID-19 symptoms and potential exposures, trying to keep that outside the center and not let anybody in that might potentially have been exposed and then expose the rest of the people in the facility. They needed to have a written health and safety plan. We don't tell them what needs to be in the plan. We did provide a template for folks to use if they wanted, to use that. That gave them kind of the elements that the plan needed to include, but we're really recognizing that every program is different. Every program has different, their facility is set up different, their staffing is different, their parent needs are different. And so we felt this was the best way to do it, to give them those key elements that like a template, and then they needed to come up with a health and safety plan that they're sharing with their parents. And anytime it updates, they update it, they share that with their parents. So this would be something for your employees to really kind of understand their childcare program's health and safety plan, because it will include things about their operations that are different from what they were during time before COVID hit. So any changes that have happened would be included in this health and safety plan. And then finally, they need to adhere to the requirements for reporting cases of COVID-19. So they basically need to make sure that they have contacted, if they think they've had an exposure within their site, or they know that they've had somebody test positive, either a child or a parent of a child or a staff person, they need to report that to their certification rep. And then they also need to follow up and report it to the Department of Health. And then the Department of Health will most likely, depending on their location, direct them to a more local health department to really kind of think through what precautions, like what needs to happen. What are those next steps then that need to happen within this program, given the level of community spread in a particular area and what the actual exposure was at the site. They'll help the program figure out, do I need to close a portion of my program? Do I need to close all of my program? For how long do I need to do that? Is it a matter of just telling some families that they need to stay at home and isolate? They'll help them work through all of those things. So, I think that, really understanding the different childcare programs that your employees are utilizing and what their plans are and how that has changed from before COVID is a really great step to kind of supporting employees and really understanding what they're dealing with. I think that's, yeah, go ahead, Christy.
Christy, did you have a slide you'd like me to share for this topic?
I think it's, yeah, if you want to just revert back to that second slide,
Sure.
the COVID changes. Yeah. So I think I spoke a little bit about this and kind of piggybacks on what Karen was saying as far as, we needed to reduce the class sizes and then establish those smaller cohorts. So the other thing is, for example, the screening procedures. We have currently have screening procedures that families need to go through when they walk into our buildings. We are lucky because we are a larger facility, so we do have staff assigned specifically to that. So I think just information or thoughts from the business community is that if you're able to be flexible with family, with employees' start times, it has increased the time for drop off because we were following those procedures that were made. So parents need to come to the building. We have a staff person there to greet them during those peak drop-off times. So we have them from 6:30 till 9:30, where they need, we complete that screening procedure. And we ask that other parents that are pulling up at the same time to wait in their car or to social distance. So there is a little bit of delay to get those students into the building, because then we're limiting the number of visitors in the building. So that means parents as well. They're not entering the building like they used to before the pre-COVID. They are now stopping at the door. And so getting that screening procedure, and then they need to get their hands washed and taken to the classroom. And we do try to accommodate as best as we can, but a lot of times there are some standard start times that really impact that. So if businesses can be, if that's something you're able to do is be flexible, that would be great, because it does take a little bit longer than it did prior. And then also you're saying goodbye as a parent's perspective at your child at the front door as opposed to in their classroom. So if we have new children or children that are returning after being off for periods of time, sometimes that transition is a little bit challenging, and then we've now changed it up on them, making their routines, as Karen had indicated, early childhood is really all routines based. We've now changed the routine. So it just sometimes takes a little bit longer for those procedures to occur. And so just things that we would like to share with the community, the businesses, to be mindful of. That's, if it's possible, it would be, helpful to your employees and your staff.
Thank you. Katie, did you want to move forward with question 2?
Sure thing. Thanks, Elle. Our next question, ladies, is could you please discuss the issues surrounding transportation for childcare providers. Also discuss how pickup and drop-off procedures have changed. You touched on that and what flexibility can be out there for parents.
Karen, are you good if I start or?
Yeah, I mean, I can be really quick because from a
Okay,
state
go ahead.
perspective, there really is no, I mean, childcare isn't like the public school system where there's a, you know, the idea that you're transporting kids. Childcare, by nature, it's the parents transporting. So, you know, I think Christy, the stuff that you're going to talk about, or you did talk about around drop off, is probably much more salient for this conversation.
Sure. So I can say I'm aware of local childcare providers that do provide transportation, but as the BCIU, that's not something we provide. It's provided by the family, so I can't speak specifically about transportation other than I know that is an option or had been an option in previously. The other thing I just wanted to touch upon a little bit about the drop-off procedures that, like I said, we do have people there during those peak times, so that kind of helps to expedite the process of getting those children in along with the, the guidelines. But then there are times when, if you have a doctor's appointment as a parent and you're taking your child and then bringing them later in the day, then they need to make a phone call back to the room, and then, a staff member needs to come get them. So it just extends the time a little bit for those drop off, especially outside of those peak windows. But that requires additional staffing, to have, which I think we'll talk a little bit about, the costs and the funding as far as concerns with, those increased needs we need to do. So again, those drop-offs, spoke about them a lot, but that really has changed significantly since we started back from COVID.
Thank you. So I think the theme is buffering time in the morning, at least, certainly by employers to be a little bit more flexible. If somebody's running late, there's probably a reason why, and the understanding there surrounding that. Next question, how will socioeconomic factors, food insecurity, abuse, traumas, be met with appropriate services moving forward?
So from a state perspective, I know, we have across the state business partners, we call them early learning resource centers. You might have heard them referred to as ELRCs. So our early learning resource centers, their primary role is to administer the Child Care Works program, so the subsidized childcare program. So they work on the parent end by determining whether a family is eligible to receive subsidized childcare. And then they work on the provider end in terms of setting up agreements, provider agreements. So providers that are going to accept subsidized childcare. They also support programs through our quality rating improvement system that Christy talked about, our Keystone Star system. So as they move up in the STAR system, that early learning resource center supports that. But from the parent side, we do have early learning resource. They are what we like to think of as kind of early learning hubs in their community. They might not actually have the services. Depending on the agency that has that grant, they might have some of those services within their organization, but they don't necessarily have to have them. They need to have the connection. So as they are working with families and determining whether a family is eligible to receive subsidy, they can also then direct them to other resources that are available in the area. So if they know that the family has expressed something around food insecurity or housing, they have access to those resources in their local community that they can point families to. I saw a question in the chat about knowing where to find childcare that was open, and early learning resource centers are a great, that's the organization that you want to go to in your community if you have questions about who is open currently. We do maintain a larger website called, it's Compass. It's related to being able to access other services through the Commonwealth online, but the part of it is Find Childcare in PA. That families can go in and kind of put in their information, and it'll give them a set of based on the location where other sites are. Unfortunately, at this point, it's not necessarily the best way to look for care because it'll show you all licensed providers that are currently operating. It doesn't distinguish if a provider is temporarily closed or if they're operating in drastically reduced enrollment. But your early learning resource center will have a bit more information about that. So I can make sure to share that with Ellen, but if you go to there's a website called raiseyourstars.org. And it's a public facing website that allows you to enter a zip code, and it'll give you the information for your early learning resource center, because there's 19 regions across the state. They all have a main office, but then within their region, they'll have satellite offices. If they're, depending on how the region is made up, if there are larger, like if it's a region that has a couple of different, bigger cities, they'll have a couple of offices. They also have, they do co-location strategies where they might, know that maybe there's a particular library that a lot of families with their young children access. And so they make arrangements to have space in that library a certain day of the week. These things are not really that applicable right now because they're doing a lot of things remotely. But anyway, they're very much ingrained in the community. And so if you type in your zip code, it'll tell you who the main organization is and where those locations are. And you could reach out to them to talk about what are the childcare options in a community. But yeah, that they would definitely know what other kinds of supports are available for families within communities.
Just similar to that early learning resource center and the Child Care Works funding, we at the BCIU do accept that as subsidized payment for childcare. So that way we can help support families that to get quality care if they need to have that assistance for paying for childcare. And Ellen, if you could pull up that slide, I think it's slide number 3 about supporting families. It just has a couple other pieces. Along with the Early Learning Resource Center and that Child Care Works, we also work with the United Way. Next one. Yep. United Way, which, so if you need to meet certain requirements to qualify for the Child Care Works funding. And so we have some families that are working, but are kind of falling through the cracks and not quite able to reach that requirements. So United Way has some subsidiary funding that we work with. They also address with some families that might have some medical or health needs. In the past, we've had a mom that, a mother of 2 who was going through cancer treatments. She didn't qualify for the Child Care Works subsidy, but she did qualify for United Way funding. So it's additional ways to support families. And we, again, do that within the BCIU program for childcare. Speaking about some of those other resources needs, the ELRC is a great resource for that, but we also on our website have community resources that families can go to. I did include a link here for food insecurities. This link is available. You can utilize this, and just by putting in the family's area, their city and state, they can get a whole list of places in their immediate community that is providing food resources at this point in time. But we also provide different information on that community link on our webpage, whether it be for mental health needs, for transportation needs, for food insecurities, a lot of different areas that you might address. And that way you can just access that information. It's easily available. And then the other piece I just want to touch upon is we are for trauma, because we're expecting as children come back to programming, they could have experienced different, whether it be trauma from COVID or other related issues because they were home and maybe that wasn't in a great situation, or there were some concerns in the family's home. We are working on getting some trainers for trauma-informed practices that we will be able to push out and support our teachers within our childcare programs, as well as our early childhood programs. So that's some things that we are working to help support families for those different needs they might be encountering. Thanks.
All right, I'm gonna unshare again here, just to keep things fun.
All right, so thanks. Next question. Will there be significant need for personal protective supplies the providers will need to source, and how will overcoming costs associated with these materials be covered?
So again, I can answer from the state perspective. Yes, yes, and yes. There's a significant increase in, cleaning supplies. So childcare, again, by nature, preventing viruses is the heart. That's what they do. That's what they've always done, even before COVID. We need to recognize that COVID is a novel virus, and this is definitely a different situation. But childcare, and in Pennsylvania, our childcare regulations are some of the more stringent regulations that you will find across the country. So the average childcare provider, if they're meeting those regulations, has already got in place some really great processes around hygiene for kids and staff, around cleaning and sanitizing. But the issue is that it has to happen way more often. And the issue is that they need different kinds of supplies. So we've, as a Commonwealth, actually struggled at times to source large, amounts of PPE and different things and cleaning supplies just for the programs that we actually administer, let alone that we actually run, let alone the programs that we administer and fund. So the Department of Community and Economic Development does have kind of a matching system on their site, so that you can go in to their site and, again, supply your general area, your zip code, and it will give you a list of different kinds of suppliers, basically a list of businesses who have said, hey, we have this stuff, and here's the contact information for Pennsylvania if you want to reach out to them. Ochdale was able to source, it was very interesting, but we were able to do a large number of no-touch thermometers that we originally tried to, we're getting out to programs that were operating on waivers during the stay-at-home orders when everybody was in red. I believe, I should have looked before I got on this call where the status was. I believe that there are a small number of those still left now that we're, pretty much everybody's open. But it's been very much a challenge. In terms of the funding for that, Ochdale, we typically, when we do Child Care Works payments, we pay based on the actual attendance of the child. When we went to stay-at-home orders, had we done that, nobody would have gotten any payment, and the childcare industry would have just completely collapsed right away from the beginning. So we were able to put new policies in place that meant that we paid based on enrollment rather than attendance. That also then meant on the family side, there are requirements to continue to receive Child Care Works where you have to work and your child has to come to school. And if you miss so many days, the family can be dropped from Child Care Works. So we also then freed up and eased up some of those requirements and basically said we don't want any family to lose their Child Care Works subsidy because of COVID, because there is a wait list in Pennsylvania. We have more children that are eligible for the subsidy than we actually have the dollars to have in the, participating in the program. So we continue to pay based on enrollment to try to help with those costs. We were also fortunate, the federal government allocated through the Child Care Development Block Grant, which is the funding that typically comes in and funds our Child Care Works program. They funded $106 million worth of additional dollars to help support the child care system. Typically, Child Care Works, we have limited ability to use those funds. They have to be used by programs that are offering or serving children on Child Care Works. The CARES dollars did expand that for us. So we have a large portion of the child care providers in the state of Pennsylvania that maybe don't participate in Child Care Works, or if they do, they only have a couple of kids in their program. And so basically they're relying primarily, their budgets are based on the private pay tuition of families. So those CARES dollars did allow us to get some dollars out the door to those programs, because up until that point, the only mechanism that we had to push dollars out the door was through the Child Care Works program. But if you weren't getting that, or you only had a couple of kids, it didn't really do a lot for you. There's another chunk of CARES dollars that came into Pennsylvania more generally, that when the General Assembly and the governor, when they passed the 5-month, the stopgap budget, they chose to take $116 million of that general CARES dollar and dedicate it to early learning. So at that point, we were able to give some subsidies to our pre-K counts and our state-funded Head Start programs, and then keep the additional about $116 million. We worked with a researcher out of Penn State to do a study on the impacts of COVID-19 on the childcare community, because we wanted to really ensure that we were thinking very carefully about how to distribute those dollars. So he is right now working with our policy folks, working with the governor's policy office to kind of take a look at that data. And we hope to be getting that data out the door, or those dollars out the door in August. So they got a first chunk of money in June, a second chunk of money in July, and now they'll get some in August, ideally. But I do have to say, it's not enough money to support the system. It's not enough money to, the increased costs of what they need to do, along with the idea that, again, their enrollments are down because many families aren't accessing care at the level that they were before for a number of very valid reasons. So it really becomes, in terms of how they're, as business folks, your business plan, all the pieces have to fit together the right way. And if their enrollment, particularly their private pay enrollment, is down, then those tuition dollars are down. So the money that's being put into the system is still not an adequate amount of money to sustain the system. And so this is a struggling system. So I think I'm going to let Christy talk a little bit more specifically about what it's like at BCIU.
So yes, similar. Obviously, we have increased our cleaning procedure. So as soon as somebody's done playing with, what we've done is we've taken our materials and divided them up. So if you have Legos, a very big bin of Legos, we put them into smaller container of Legos. So one child could play with them, and then they would need to be cleaned as soon as they are done playing with them. So we quickly realized we are going through our disinfecting and sanitizing cleaning materials frequently. So a little bit higher rate than we thought, because we had great cleaning procedures before. They are more intensified based upon the current situation. And so we were able to receive some of those relief dollars that Karen had alluded to. There was a formula. So, but again, you're spending a little bit more because you're cleaning so frequently, as well as different centers require different things from masks. So you would need to have backups. If you have families bringing their own masks for students, you need to have additional supplies in case somebody, it gets soiled, falls in the toilet, was one that has already happened. So you need to have those additional supplies available. So luckily with our facilities, we were able to secure some things starting in March, but we're really coming upon some areas that there is difficulty getting some of those supplies from resources in the community. So it continues to be a concern. I think somebody asked, how else can you help as businesses? If you have, families or employees that are at a childcare center, if you could offer, any kind of masks or something to help support them, that could be beneficial to those centers. And it would, possibly even offset the cost for your employees, because generally they are requiring that families or bring children with their own masks. It just depends on the different center, but really because the different children like different type of masks, there's so many out there. And so we, the right fit for the right child is what you kind of have to work through. So we really have to be cautious too. I go back to, we had to reduce our classroom size for the social distancing. It's very difficult to have, 20 students in a classroom that's usually your ratio, but now you need to adapt for that social distancing. So we dropped our numbers for that. So there's less dollars coming in, but yeah, you're increasing the amount for all these cleaning and PPE supplies. And so we can only pass so much of that on to the families, because they are also, working families trying to provide for their families, as well as, getting great quality care. So.
I have to laugh. So my 2-year-old is in that monkey see, monkey do phase right now. And so she'll take the broom at the house for a walk all the time. And I know that's from daycare because they're just cleaning constantly. So I'm hoping that will breed positive behavior patterns here at home, but we'll see if that sticks. So want to preface this next question with, we get a lot of conversation about what are the rules. And every time we talk about that, I hear the quote from Pirates of the Caribbean, where this is more like guidelines, really. And so, how do we interpret a bunch of this? So if you could please discuss the guidance from the CDC and the intent behind it, as well as how can this be interpreted from center to center? Karen, can you touch on the following? As an employer, the need to be communicating with employees about what their centers are requiring and are providing. Just making sure that employees are sharing center plans with their employers.
Yeah, sure. I mean, I think I touched on that before, but the ever-changing nature of this means that programs could conceivably be updating their plans quite frequently. So the idea that, if you are letting your employees know that you need to understand when things change at their childcare center, particularly if it's going to impact their ability to be at work, that's a good thing. And again, I suggest if you're able to reach out to that childcare center, I can't imagine any childcare center that is not going to react well to a business in their, that employs some of their families, trying to proactively develop a relationship and understand what these extraordinary conditions that they're needing to work under and that the children are being, served under. So the CDC guidance, again, I covered before, that it is guidance, and it's very broad. It's very much written, and because they're not a regulatory body, they need to use language. There's a lot of language that talks about that programs should do things, but they don't use words like programs must do things. And then there's a lot of language that's attached to those things, like to the greatest extent possible. So, again, in the childcare world, we have our certification regs, and those are very clear. They're very clearly operationalized. So to really understand, am I meeting that regulation or not? It's to keep, it's to get rid of all the gray. You're meeting it or you're not, and programs can understand that. The CDC guidelines are not quite that way, because they need to apply to a family childcare provider that maybe sees 4 children. And if I'm doing screening prior to coming into the house, that literally means I'm doing it on the sidewalk outside of my house, my townhouse, because the minute they walk into my center, they're standing at the bottom of the steps that lead up to my bedroom in my private residence. Versus you're talking about some of the larger sites that have other kinds of things that are operating under them. So something like a BCIU, where you're probably walking into a building that might have other things in it, and there's a lobby, and there's an entryway, and you can set up that space where it's separate. So these guidelines had to be written in a way that any kind of provider, regardless of what their setup was able to look at them. And that's been challenging. And that's what Octel's really tried to do, both by issuing those updated guidelines for programs, by pulling out those critical elements that we think are just non-starters. You must be doing these, or you could be cited, because these are the real safety issues. But we've also then, through one of our other business partners, the Pennsylvania Key, we have a woman named Amy Request. She is our senior health manager. She has a long career in public health with young children. She's done a lot in early Head Start and Head Start, very familiar with the early childhood world, but also the health world. She's a sort of pediatric nurse practitioner. So what she has been doing is developing a series of webinars and frequently asked questions that take that CDC guidance and tries to kind of unpack it and talk about specifically what does that look like in a program. So how do, what's the intent behind a particular part of the guidance, and what does it look like? One of the things that we hear all the time, social distancing. How do you social distance 3-year-olds? How do you tell 3-year-olds that they have to be 6 feet apart? And it's not the same in an early childhood setting. So you do try to think about the classroom that you set up, the environment, the toys that you have out, the activities that you're suggesting. But a bigger part of social distancing in the early childhood world is cohorting. So you basically say, we're going to take the same group of kids, and this is the group of kids, and we're not going to mix them. Pre-COVID times, a lot of sites would have a room that during the drop-off and like early in the morning drop-off and later in the afternoon pickup, they would have different classrooms, kids from different classrooms there. So, and that was a way to control staffing and their staffing patterns of their teachers. So in the morning you come in and your child's in this room, and when we hit a certain mass of kids, then we break off and go into 2 rooms. Well, we're not doing that anymore. We have to go into that same room. And the goal then, and then it's the same adult that are with those kids. So the goal is that if there would be somebody exposed to COVID-19, that they're only impacting that cohort of kids. They're not impacting the cohort down the hall. So we did things like suggesting that programs keep siblings together. So our childcare regs, most of our childcare system is based on age. So you know, we've got our infants in one room, we have our young toddlers, our older toddlers, our preschool age kids, our school agers. Well, we're suggesting now that maybe you do mixed age groups, which means that you have to follow the ratio for the youngest child in the room. So infants, it's 1 to 4, and preschoolers, it's 1 to 10. And if you're keeping a 9-month-old with their 4-year-old sibling, you've now gone from a 1 to 10 ratio to a 1 to 4 ratio, which is an increased cost for the program. So trying to really help them think about what does that guidance mean and what does it look like in their particular program? So we have Amy working on that. We're also rolling out additional health and safety supports. Through our Keystone Stars program, we had part of that, a component of that program to move it, but to our higher star 3 and 4 level was a program quality assessment. So there are some standardized assessments, and we have a group of staff that have been highly trained. They go frequently for retraining. They have reliability, like, you know, they're able to, if I look at this room and see something, you're looking at the room and you're going to code it the same way. So they come in and they do these assessments on programs, and you have to get minimum scores to move up through the STAR system. Those things aren't happening right now for a number of reasons. It's not safe to have other folks, outside folks coming in if they don't have to. A lot of the elements that are in those assessments, we're not able to do right now with COVID because they've needed to change the materials that they have. Kids can't have access to the same amount of toys and the same kinds of toys the way they could before COVID because we need to keep things clean. So this program quality assessment team is really shifting focus around health and safety. And they're working with our early learning resource centers and the quality coaches that were supporting programs as they moved up through the GRCA system to really focus on health and safety and kind of think about those needs. So there's a lot of training going on for folks now to get up to speed on the CDC guidance so that they have the tools in their belt so that when they're out with programs, they can be supporting them. So we're just a few weeks away from really, I think, programs really starting to feel those changes that we're making, because we want to make sure that the staff that are going to be doing that really have what they need. I think I'm going to pause there and let Christy maybe talk about it from the perspective of.
So just a little bit about that is that, again, there's many announcements, as we've alluded to, that come out frequently. Changes are made. So I think from our perspective, we are in a good situation, whereas maybe some smaller programs are not. We do have a team of supervisors that can review the announcements, determine if any changes need to be made. And then what we would do is we would make those changes in a timely manner, but there does take a little bit of time for that to occur. We then communicate with our staff and then with families next, because we want that layer of, you know, informative people. But I think we have that benefit. If you are a smaller program, you might be the person, you know, supervising the group who is also writing the procedures. So sometimes that turnaround time is a little bit lengthier for those smaller locations. So you might hear the masking requirements or the masking order, and then you would think it would be in place the next day, but really there is a delay that has occurred because we need some of that time to kind of review the information, make the changes, and then put it into place. But I think that's, you know, ongoing concerns that we will continue to navigate as we move forward.
Alrighty. Christy, this one's a little bit more for you. I know we talked about this last week a little bit. Talk to us about the timing required by centers between the moment a regulation is announced and the actual ability for the center to be able to adapt and change their policies and communicate them externally. So how is that process streamlined? How are you able to communicate best with parents and do so in a way that's both responsive but also cautious and thoughtful of what needs to happen, being that everything changes so constantly?
So like I said, we are able to kind of pivot and make those changes within a reasonable amount of time. We really have, we have enrollment specialists at the BCIU for childcare. So they are kind of our connections with families. We use a lot of email, and then as well as a mass communication system. We use Blackboard Connect as we're able to then push that information out to families. And we also want them to have time to maybe adapt or change to some of those things that they might need to, you know, do a little differently, or they might need to purchase something, whether that be a mask or a different face shield or something like that. So again, we do our best to try to give them some reasonable amount of time. So we're able to pivot, but not always pivot on a dime. I think that's a difference. Because we are a larger site, we are able to do that with additional support staff.
Thank you. I'm up again. So this question refers to the types of new and revised training that will become available or has become available for staff, parents, and the students and youth themselves. So how are we, or how are you, either re-educating or providing new training on anything from safety to wellness, and trying to support everyone along the way and how to move forward?
Yeah, I feel like I jumped the gun on this question a little bit and just did touch on it a bit in the last question. We've really had to kind of, the question that we've been asking in our office is, what does quality look like during a pandemic? Because we have, Pennsylvania has one of the, what we would call a mature quality rating improvement system. We were one of the first states to implement one. A couple of years ago, we went through a very rigorous kind of evaluation of that system, and we revised it based on the data from that. We were actually in the middle of an ongoing revision or evaluation of that program that now that's the next question is, what does a pandemic do to your evaluation of your ongoing QRIS program? But we have a lot of, we've definitely shifted our focus to the idea of really making sure that the health and safety, that centers know what they need to do and have the information that they need to make sure that they can meet those health and safety standards. We've got, it's also about kind of stepping back.
Hoping we get her back soon. Chrissy, if you want to, I'm sure she'll come back soon. Oh, there she is.
Really, yeah.
Karen,
yeah.
You were frozen for a bit there.
Oh, okay. Sorry about that.
Maybe
Am I
like
okay now?
10 seconds ago or so.
Okay, sorry.
If you could just rewind, that would be great.
So I was saying that I think the other part of this is not only is it the health and safety aspect, but it's really supporting programs around their relationships with families and their ability to communicate with families. That, for programs that have these really good ongoing relationships with their families and open communication with their families, these things, I don't want to say they're easy, but there's at least a mechanism in place for all of this to happen. So really trying to have the staff that are going in and supporting programs really focusing on what does it mean to meaningfully engage families? How do you, understanding what their worries are, understanding what their fears are, understanding what their needs are, what's your schedule, and what can we do to accommodate that, but while also meeting these additional guidelines that we have to meet to keep everybody safe.
So I will just speak a little bit from the center perspective, is that we do have increased our training in childcare. They have like Karen has said, there's a lot of regulations and requirements around hygiene and making sure students are doing preventive procedures always in the past. So we have escalated that a little bit. We're going to be doing some COVID overview and prevention for our childcare. We will continue to our other early childhood programs. Disinfecting and cleaning, I think I talked a little bit about, we have those different procedures in place as far as once the child plays with it, we're washing it right away. Things such as, relevant specifically to families, like lunches, we are now requiring that you have to pack a lunch and you have to have an ice pack in there because we don't have enough fridge space. We don't want the lunch boxes to be touching each other, as well as their personal items that they bring in, whether it be backpacks or blankets, those kinds of things. We try to eliminate where those places are. So teaching students about, those children about doing those things, again, reinforcing that hand washing, have hygiene techniques. The other thing I just wanted to highlight is that there has been some, sometimes there's concerns with younger children and wearing the masks. A resource that could be available is there are social stories. There are many different, if you Google wearing a mask social story, you can get a lot of different websites that provide that information. And what it is, it's just a simple story talking about why we wear masks or why you're seeing other people wear masks, or just very simplified language with some simple pictures. But again, that could be helpful to some families that might be struggling with their students wearing masks. The other piece that I just wanted to tie into is that I lost my train of thought. Sorry about that. Wearing masks. I don't know what it was about that, but anyway, so if that might be a way to help some of your employees from a business perspective, you hear some of those conversations, there are these, resources out there that are just very easily accessible and free. I will say that we really have seen a significant, the children in our childcare program are resilient. Really, they just kind of adapt and do whatever whatever the changes are, they kind of go with the flow. Maybe the first, few times they're coming into the center or the classroom, they're need to refamiliarize. But we have established, they have their own pencil boxes with some of those readily materials that you might need: scissors, crayons, pencils, those kind of things. So they have like a small jar of Play-Doh. It's all right there, and it's only specifically for them. We've divided our tables so that there is there's lines on the table to separate them, as you're going to be on this one side of the table, I'll be on the other side. But really, they really have been really resilient. Wearing their masks is just a part of their day now. So, and that I hear that from, we had very anxious staff prior to coming back, but really as they are here and they're seeing the kids, it's just kind of, this is how it is. The new normal. I know that's not the greatest thing people like to hear, but that's kind of how it is at this point in time. So just some, general information that you can access to help if you needed to support some of those concerns.
I want to be the person that coins the next term after new normal, because I think we're all tired of that one. So we'll have to come up with a new one going into the school year.
I did hear the next normal. So
okay.
that was something I heard just today. So I don't know if we like that one or not, but
I like back to normal one day, hopefully. So we'll strive for that. All right, you get another question from me. So, and then you'll get a break and you'll get Katie. And this is a biggie. So I imagine this will have a lot of input from both of you. But how has the coronavirus exacerbated inequality in childcare deserts, both for Berks County and what you're seeing across the state, Karen?
Yeah, it's definitely had an impact. So we knew that the Workforce Command Center had already identified that childcare or lack of access to high quality childcare was one of the biggest barriers to employment in Pennsylvania. And it was already a focus of this administration to look at how to increase access to quality childcare, particularly in places where there just isn't any other options. So we know that as we're looking at this, we've lost probably about 65 programs currently to COVID related issues. So the fact that they had to, close down their business, they might not have had families that were essential services, or enough families that were essential services that needed care. So they did not apply for a waiver and they weren't able to open. One of the groups that is actually very much struggling are, again, families or programs that rely mostly on private pay tuition families, and maybe don't have as many families that are accessing subsidized childcare because Octal didn't have any mechanism to continue to pay those, to make up for those losses in tuition. We know, again, that, a big part of the business plan for, a robust business plan for a childcare provider is having the right, a full enrollment, and then full enrollment that they are actually collecting full fees on. That they can then offset the cost of operating, which, most of the costs of operating are related to, staff, their staff salaries, staff, any kind of benefits, those kinds of things. So when enrollment is down, particularly if it's down only by a certain number of kids, you still have the same amount of staff, you still have the rent, you still have the light bill. So without those incoming tuitions, we know that that puts a huge strain on programs, and we really are, very much watching what's happening. We did, during the first round of CARES dollars, we did choose, so we started out with a base payment for all programs really based on their size. based on their capacity. So larger programs got additional funds. The next layer that we laid on that was an additional add-on for childcare works families. So, you know, if you had 10 kids that were in childcare works, you got a certain amount of money. And then we had a third layer, and that was for programs that were located in deserts. So places where they were really one of the only places that people could access high quality childcare. We knew that if they went out of business, that was just not going to be tenable for our community to lose the only childcare business that they had. So I think it really has kind of shown those programs that had business plans in place that really understood that iron triangle and had the right amount of enrollment and could collect on those fees. They're struggling still. It's not enough, but there is a difference in what they look like. And I think looking at, you know, just our low income communities who I think, you know, we know the COVID hit low income and minority communities even harder. The same is said for what's happening in childcare. Those families, if they're not, you know, if unemployment is higher, then their need for care is lower, and those centers are then going to struggle with how to maintain and stay open and pay staff and actually provide care for the families that, you know, are able to, you know, access care and need it. So it's definitely an ongoing issue throughout the state. It took, this is a sector that was already in crisis because we do not adequately fund it. I think I said earlier that, you know, the childcare works, we don't have enough, we have a wait list. There are more children that are eligible for childcare works than we have dollars to do it. But then we also have issues with the base payment that we pay providers. You know, what we pay them per day to take care of children does not, it doesn't add up to what it costs them to provide high quality care in most places in the state. Oh, excuse me, I thought I turned my phone off. Sorry about that. Now I lost my train of thought, sorry. I think I'm gonna let Christy speak up then.
So just, yeah, similar to what Karen was saying, the high quality in the areas has definitely been a concern previously, but now we have been informed from our other programs that help support out in the community of quite a few, you know, at least 7 in the last week and a half or so that were, you know, good quality centers that we supported some of our early intervention side of the house, supported students in those locations, and they are closing and not reopening, or they are not going to reopen for the fall, and they don't have an anticipated reopening date. So we are, again, fortunate that we are able to do the childcare that we can provide, but we also reduced our locations. You know, we took we had Daniel Boone and Exeter, and we combined them down to a lower Alsace or the Mount Penn area. So families then needed to travel further to access that because we needed to have more of those defined BCIU sites that we could provide those services to. So I think it has really been, the COVID really has impacted the amount of child cares, and that quality level continues to be a concern as it was before, but it has now just increased.
All right, ladies, next question is talking about employers and how they interact with employees with young children. And I want to kind of highlight, so it's an equal burden thing for families and parents, but right now the virus is really showing a strain on women. And typically gender roles, women are the ones who take care of the children and or ailing family members, and the impact that can have on careers. And this virus is having an exacerbating effect on their ability to either stay in the job market or to move up. But how can we talk to some of our employers about possibility of setting up an in-house childcare situation, flexible schedules, stipends for childcare cost, flex spending accounts? There's ways to do it, and what are some suggestions that you would put forward?
Yeah, this is a great question. And we actually have, prior to COVID, we worked within Department of Human Services and also with the Early Learning Investment Commission. And we, right as COVID was kind of kicking in, we're very excited to release a toolkit called Opening a Childcare Facility in Pennsylvania. And I know Ellen and Katie have access to the links to the toolkit, and it does a lot of, it gives, it talks a lot about specifically the childcare regulations in Pennsylvania. So, but what it also does is it lays out all of those different options that you just talked about, Katie, the different ways that you could look at how childcare could be a benefit, or supporting childcare in your area could be a benefit to your employees and could actually use to attract, talent to your business. Everything from, the steps that you would need to take to open something in-house, whether that's something that you ran, whether that's something that you had the space and you contracted with a provider in the community to come and maybe open another, run that space for you, to how, again, like Katie talked about, can you subsidize slots at a site? Can you provide any kind of a pre-tax, almost like you would do for a health savings account, those kinds of things. So that toolkit is, Katie just stuck that in the chat. And we'd love your feedback on it. If you take a look at it and think come up with a different idea, something else that you've tried that's worked. But it was really about, it was about trying to help the business community think about, were there ways that they could increase the number of childcare slots that were in their area. But it was also about trying to help the business community think about the idea that childcare is an asset and it could be used as a recruiting tool. It's a benefit that you could, there are different ways. It's not just about opening up a childcare. There are other ways that you could look at, partner with existing childcare programs to make that a benefit for families.
I just could piggyback a little bit too, along with years ago, it was mentioned that I was the director of preschool teacher at Country Meadows, and that was a program that really was sponsored through Country Meadows, through the retirement community. So they had childcare so they could have staff have access to quality childcare. Now that was, more than 15 years ago, actually like 20 years ago. But anyway, so that was just a great incentive. I think that you could then, be an employee and then as well as have your children right there and go pop in and see them. So that was a great forward-thinking option. So just some opportunities to think about if you're a business and looking to attract that, because as Katie had said, that really is a need, especially often with more of the female employees.
This next question really just piggybacks the last question, but kind of flipping this on its head. So instead of our business owners and their employees in trying to accommodate, how have childcare facilities been able to incentivize or support essential employees during COVID-19? So how are they retaining talent within their facilities? Because we know that within childcare, it's hard enough to keep talent. And how are we making sure that we're still having quality programs while also meeting new safety standards and keeping the talent that has sort of that institutional knowledge and experience, instead of having to onboard new employees? What can we do? What has been done to sort of incentivize them to stay?
Yeah, this is also a real struggle for childcare programs at this point. Again, Octal was able to continue those payments, their CCW payments based on enrollment. It was our hope that would equate to providers being able to continue to pay staff. But we know, we've heard it from a number of providers, that the unemployment benefits, when you added in the extra pandemic unemployment that the federal government was offering, there were many, many early childhood staff that could make more on unemployment with those added benefits than they could by working. So this isn't just a struggle during COVID times, it's a struggle in general in the childcare community. So it's a struggle to, when you get qualified staff, when you get staff that have degrees, you can't necessarily fault them when they decide that they're going to go work at the school district, because the school district can pay them more and offer them different benefits than you're able to do. So it's an ongoing struggle. We, last year, Octal was able to launch what we call our professional development organizations, We've got, they're located across the state. There are actually 2 organizations that are running them across the state. Public Health Management, PHMC, is actually running it in your neck of the woods. And then we have Shippensburg University is working with other PASHE schools to run it in the other parts of the state. And they're really charged with looking at career pathways for childcare staff, looking at innovative ways to create, all those different ways into the system for childcare staff. So figuring out how to get experiential learning, get credit for experiential learning, how to look at competency-based learning, so that staff, can then attain those higher degrees and maybe start to make more. But it's an ongoing struggle for the childcare sector, trying to meet that need.
I can speak a little bit too from our perspective. We are able to offer some professional development because of the size of our organization, as well as some flexibility with schedules, which has helped to support the retention of staff. And we do have, they're able to access the retirement and benefits package, which is for some of them for full-time staff, which is not always available for other locations, but it continues to be a struggle for us to maintain high quality, high talent staff within our programs.
So sort of adding on to that, this whole series of questions, in a recent report by the International Finance Corporation, there are many options outlined for employer support for those with children. A few of them include supporting parenting skills through parent peer groups within your company, providing parenting workshops as personal development tools, better supporting mental health and well-being through corporate wellness plans, providing financial support or subsidies, and possibly offering emergency childcare services where available. Have you seen any local or regional employers adopting to a more supportive model? If so, can you talk about any best practices you've seen from employers?
So this is not completely my area of expertise at this point, but I do know that Sheets, the Sheets Corporation has, they've got at least one childcare site that they, corporate-based childcare site that they have. We know also PSECU here in the central part of the state has some employee-based childcare, on-site childcare. They went with, I think both of those organizations went with a model. No, actually, I know the PSECU, their model is that they have the space, but they've got another larger childcare, multi-site childcare organization that runs that for them. But those are the 2 that I know of off the top of my head that have had some success with that. And both of those I know throughout the pandemic when I've been on calls where they wanted to kind of highlight a site that was, kind of having some success with all of these challenges. They were sites that were picked. In fact, when the governor announced the second round of CARES funding, the press conference that he did it outside the PSECU childcare site. So if those would be 2 sites that I would take a look at and check into.
Christy, did you have anything on that?
No, I think a little bit that we alluded to, we're trying to help support more of that mental health aspect through, getting some of our staff in that as train-the-trainer models for trauma-informed practices, because we anticipate that it's going to be a continued need moving forward.
And I would just add a plug that throughout, I've been in touch with a lot of employers that wanted to be more accommodating, but certainly weren't sure where to start and hadn't previously had any procedure or process in place. And so I don't think they would mind if I gave them a shout out, but I know Brentwood Industries locally here had even contacted me and said, hey, we're willing to start sort of an in-network, employee-to-employee, peer-to-peer, portal, if you will, of those parents that work here that have high school or college age students or kids that might be willing to provide childcare for those with younger age children. So that in itself, I felt, okay, well, who knows how that will work out for them, but they're getting creative and they're certainly trying to internally figure out a way that works for their employees and be supportive of that. So I am starting to hear stories like that locally too. But I imagine that's an area where our businesses could really continue to use some peer-to-peer on this. And so whether it be through the IU or Berks Early Learning Coalition, or, maybe that's something we as a community need to look to continue to have conversations around and try to help everybody brainstorm through this, because it will look different for every company and certainly won't be changing for the better anytime soon. So how then do you get creative and look to solutions for it? That is all the questions I have, and we are right up against 2:30, so we really did this right. Again, we really appreciate Karen and Christy your time today. There were some questions in the chat that I'm not going to dig into right now, but just for the good of the group here, if you have questions that you would like me to follow up with our speakers on, we can possibly get some answers for you kind of post-event and then email them out to everyone. Please go head over to the chat and throw your questions in there, and then we'll filter through those and get some answers for you. Thank you so much, everybody, for taking the time today on this important issue. I would plug that there is a third session of this series next Wednesday, same time and place, and that will be entirely focused on a business feedback forum. So you're hearing all of these things, you're starting to see the district's plans, you've hopefully been on each of our first 2 sessions, you're taking a lot in, and now it's time to kind of share out what your concerns remain to be, possibly have a brainstorm for some of those questions and concerns, and we'll actually be asking for your questions and comments from the business side ahead of the call next week. So I encourage you to both sign up for that and then also start to think about those questions and concerns that you have that are outstanding that we can navigate through and talk through together. And again, that will be held with team members from the BCIU and potentially a third speaker next week, next Wednesday, July 29th from 1 to 2:30 p.m. Katie, Karen, Christy, did you have anything else for today?
No, I just wanted to thank you, Ellen and Katie and the staff. Really appreciate this, establishing this information session. And please feel free to reach out to me if there's anything else I can help with the business community.
Yeah, and I would echo, thanks for doing this. Thanks for including, Octal in this. And if there's anything from a state level that we can be supportive with, just please let me know.
Well, very much appreciated, ladies. Thanks for digging into all of our questions and going through this with all of us, and for everybody that's been participating. Hopefully this has been helpful information. We keep using the word pivot or new normal or however many terms we're going to use, but it is, and you can't say you weren't informed if you had a chance to listen in. So this has been an important discussion.
Last thing, this has been recorded, so we will get this out as a follow-up to the group as well in case folks had to hop off at any time during the call.